Hello, my name is Heather Laframboise. I'm the Avita Program Director at Avita of Brunswick, and today we're going to talk about natural cognitive aging, dementia, and the things we can find in between. During today's in-service, we're going to talk about the natural cognitive aging process, mild cognitive impairment, the impact that dementia has on the brain, and dementia prevention, 10 ways that we can love our brains. First things first, everyone forgets things at times. How often have you misplaced your keys or forgotten the name of a person that you just met? A modest degree of memory and thinking skill challenges are a fairly common part of the aging process. There is a difference, however, between normal changes in memory and memory loss associated with Alzheimer's disease and other types of dementia. Some memory problems are also the result of treatable conditions, and these are known as reversible dementias. Here are some facts on the natural aging process. Almost 40% of people over the age of 65 experience some form of memory loss. It's important to keep in mind here too, though, that there are some folks who don't experience this memory loss. Those are the folks who you might consider sharp as a tack. As we age, subtle changes in memory occur naturally as a part of the aging process. If there's no medical condition, this would be considered age-associated memory impairment. Mild cognitive impairment is not a normal part of the aging process. Normal age-related memory loss doesn't prevent anyone from living a full and productive life. There are a number of things that can cause problems with memory or make normal age-related changes even worse. These things include medication side effects, existing or developing health issues, mental health concerns such as anxiety, depression, post-traumatic stress disorder, just to name a few, sleep disturbances, and other medical conditions including heart disease, infections of the brain tumor, blood clots, head injury, thyroid disease, dehydration, a urinary tract infection, or vitamin deficiencies. It's important to know that memory problems that begin to consistently interfere with normal daily life, activities, and functioning are not considered a normal part of aging. So let's talk about normal aging changes versus the changes that take place when somebody's been diagnosed with dementia. So with normal aging, it's normal to not be able to remember the details of a conversation or event that took place over a year ago. So let's go back to those missing keys. A lot of us know what that feels like. Now with dementia, it might be that somebody is not able to recall the details of recent events or conversations. So let's think about how it would feel if you looked at that set of keys and you knew that you should know what to do with them, but you just can't figure it out. Another part of normal aging, not being able to remember the name of an acquaintance. With dementia, not recognizing or knowing the names of a close family member. Imagine what that would feel like. I know that I know you, but I can't quite place it. For normal aging, forgetting things and events occasionally, and with dementia-related changes, forgetting things, events more frequently or very consistently. With normal age-related changes, occasionally having a difficult time finding words, and with dementia, frequent pauses and substitutions when finding words, and maybe even having conversations that don't make sense to the other party at all. And finally, with normal aging, being worried about your memory, but your relatives are not. And when it comes to dementia, your relatives are worried about your memory, but you're not aware of those problems. Now let's talk about mild cognitive impairment, or MCI. This is the stage between the expected cognitive decline of normal aging and the more serious decline that comes with dementia. Mild cognitive impairment is not considered a form of dementia or delirium. What's important to note here is that many folks living with mild cognitive impairment are living in our traditional communities and are very successful. However, some of these folks who are living with MCI may be on their way to needing the support and care of one of our Avita communities or neighborhoods. Mild cognitive impairment causes a slight but noticeable and measurable decline in cognitive abilities, including memory and thinking skills. Somebody might be aware of the changes in their memory or their mental function, and they also might feel like they're starting to slip a little bit. And at this point, family and close friends are probably starting to notice those changes as well. However, these changes aren't severe enough to significantly interfere with their daily life or their usual activities, and this is why they can be successful in our traditional communities and assisted livings. A person with mild cognitive impairment is at an increased risk of developing Alzheimer's disease or another form of dementia. However, some folks living with mild cognitive impairment may never get worse. Here are a list of memory problems that are associated with mild cognitive impairment. Sometimes someone might forget recent events, or the same question or story might be repeated. This might even be where you hear somebody say, I know I asked you this question, but I just can't remember the answer. Appointments or planned events can be forgotten. Somebody might forget a conversation about something, or a conversation with somebody, and this is where the repetition begins. Items can be misplaced. There can be trouble coming up with the right words. And it might be that the wrong word comes into a sentence, or they might use a nonsensical one. Distractibility can be an issue. Having the need to write reminders to do something so that they don't forget. This is where you might see post-its or notes written in random places. Other systems that can support memory, such as labels on the dresser drawers, in the closets, in the bathroom, things like that. Folks living with mild cognitive impairment might struggle, but can still complete complex tasks such as paying the bills, taking medications, going shopping, other household tasks that might need to take place. And somebody living with mild cognitive impairment might have some important memory impairments, but they can still function independently. Folks who are living with mild cognitive impairment are still able to cover very well for the changes in their memory and cognition. As mild cognitive impairment progresses into a form of dementia, we're seeing the same symptoms that we discussed in the previous slide, in addition to some other ones, or we may even see the worsening of the symptoms that we had just talked about. Some of the symptoms related to dementia that we might see include the inability to perform complex daily tasks such as cooking, paying bills, going grocery shopping, driving. The lost insight or awareness that there is memory loss taking place. People might not remember that they've forgotten what they've forgotten. Getting lost while walking or driving in a familiar area. A great example of this might be somebody walking out to the mailbox and then walking down the street instead of going back in the house. And displaying poor judgment might be that this is taking place in the rain and they're in their pajamas. Memory, language, and cognition become so impaired that self-care tasks can no longer be performed without the assistance from another person. And this might be one of their loved ones, or it could be a caregiver in one of our communities. There's a decline in rational thinking and the ability to problem solve. Now keep in mind that everybody problem solves and thinks differently. So everybody listening might have a different solution to a problem that they encounter. But when that impairment takes place, it's going to seem a little unusual, like potentially somebody climbing on a counter to get into a chair that's pushed in. And lastly, misplacing items or putting them in inappropriate places, like putting a wallet in a kitchen drawer or a mixing spoon in a medicine cabinet. Things might disappear, and there might even be suspicion that those items have been stolen, when in fact they've just been misplaced because they've put in an unusual space. Now let's take a look at the Global Deterioration Scale, or the GDS. Now, this is not a tool that we use to place labels on people who are living with a form of dementia. However, this is a tool that helps us to understand the progression of the disease, as well as for us to recognize what kind of support our residents may need as they move through this disease process. In level 1, people are still living within the community, or maybe even in one of our traditional independent or assisted living communities. And they're unaware of changes because these changes haven't really started to take place yet. In level 2, community living is still taking place. People might be starting to move into our traditional settings, or they might still be living at home, but they're starting to notice changes. This might be when the conversations with the doctor start to take place. These changes that are taking place, however, are something that people who are living with this disease process are able to adapt to because of routines and systems that they put in place while they were living in level 1. It can be really frustrating for them to have that routine or to have a system break down, and this may cause some frustration, but they're still able to move on and live a pretty successful life independently. In level 3, folks are still living within the community or within one of our traditional communities, and this is where other people are starting to notice in addition to themselves and maybe their close loved ones. This is where you as caregivers might start to notice the changes that are happening with the cognition of some of your residents. This might also be where other residents are noticing these changes, where somebody might say to one of their friends, "Hey, don't you remember your room is down here? I told you that this morning," or something similar to that. In level 4, this is where safety concerns really become an issue. This is where other services are needed. So when somebody's living within level 3 or level 4 of the GDS scale, you as caregivers who are working in our traditional communities should start thinking about talking to the nurse or bubbling these concerns or these changes that you're noticing up to the department leaders so that conversations can be had with family members to prepare them or to discuss that maybe an Avita neighborhood or a community would be a better fit for their loved one. Now, to continue talking about level 4, safety issues that we might see is that somebody doesn't remember to turn the stove off while they're cooking, or they might forget that they have an adaptive device like a cane or a walker, and they try to go down the stairs with it instead of use the elevator. The list could go on with examples. In level 5, wandering with an agenda is something that somebody experiences. They might be looking to go home if they're living within one of our communities, or they might feel like they need to go to the bank to take care of their finances, or they might be looking for their children who maybe even are in their mind younger than they actually are. With ADLs or activities of daily living, there might be some support or some limited assistance that's needed, laying clothing out so that they have the reminder that they need to change their clothes in the morning when they wake up. And then with level 6, people are wandering without an agenda. People are moving around our communities. They might find themselves in an apartment with an unlocked door, or they may even walk out a secure door behind you, but not really know why they're there. Folks who are living in level 6 are really in need of more hands-on assistance with ADL care. And the assistance that they need is going to become more and more significant as time progresses. And once somebody gets to a level 7 in the GDS scale, they're really totally dependent on us for ADL care. And also other services at this point may be needed, like in-home care supports within our communities, or even hospice services. Take a minute to consider these two questions. How many types of dementia do you think exist? If you said more than 100, that's definitely right. And is dementia a disease or a symptom? We're going to talk about that in the next slide. Now let's answer that question from the previous slide. Dementia is considered a symptom. In addition to that, it's also considered an umbrella term. Now what that means is that dementia is not actually a diagnosis. Underneath of the umbrella of dementia, there are many types of diagnosis, including Alzheimer's disease, which is the most common type of dementia, vascular dementia, Parkinsonian dementia, frontotemporal, and Lewy body dementia are just a few of the most common ones that we might see within our communities. Now let's talk about dementia as a symptom. What this symptom looks like is changes in memories, behavior, and abilities to think and process. Now let's talk about cough as a symptom. A cough could be a symptom for many things. Maybe a common cold or allergies, COVID. It could just be a tickle because of some dust. Now, just like that, the dementia or the changes in thinking is what's taking place based on the diagnosis that somebody has. And the way that that looks is going to vary depending on the type of dementia. Non-reversible cognitive changes are those cognitive changes that take place as a result of a type of dementia. As I mentioned before, some of the types of dementia include Alzheimer's disease, vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. Pick's disease is also a very fast progressing type of frontotemporal dementia, and this is just to name a few. Now here's another question for you. Can someone have a diagnosis of more than one type of dementia at the same time? And if you said yes, that answer is right. Let's take a look at the changes that take place in the brain with normal aging and with a diagnosis of Alzheimer's disease or another type of dementia. What are some of the things that you notice? A change in size, a change in the color, the gaps are expanding. All of those things are definitely happening. The cortex in the brain starts to shrivel up, damaging areas involved in thinking, planning, and remembering. And this shrinkage is especially severe in the hippocampus, which is the part of the brain that plays a key role in the formation of new memories. And the ventricles, or the fluid-filled spaces in the brain, are starting to grow larger. And the fluid in the brain is also getting thicker and becoming more jelly-like. And this is interfering with the synapses and the nerve functioning within the brain, which is causing the changes that we've talked about. Now we're going to talk about reversible cognitive changes. These changes are typically the result of a delirium. Delirium is something that comes on quickly, but when the condition is treated properly, can be reversed and somebody can go back to their normal baseline of cognitive functioning. Some of the reasons for these cognitive changes might be a result of medication side effects, polypharmacy, maybe somebody forgot that they took their medication and they took it again, dehydration, malnutrition, a urinary tract infection, depression, a vitamin B12 deficiency, certain tumors or infections in the brain, or problems with the thyroid, kidney, or liver. Here's a little bit more information about dementia. It is possible to have more than one type of dementia at the same time. 60 to 80% of people who are living with dementia are also experiencing depression. Now here's a little quiz from your brass rings training. How many days does it take to make or break a habit or learn something new? And the answer to that is twofold. For someone with normal cognitive functioning, it takes 21 days to make or break a habit or learn something new. And it's not far off with somebody who's living with cognitive changes at 35 days. Currently, there are no medications that can prevent the development of a form of dementia. However, there is currently a medication that may slow down the process if that medication is taken in the earlier stages. Aphasia is something that can occur with individuals who are experiencing dementia, and this is the inability to comprehend and or formulate language. So somebody might understand but not be able to get their words out, or vice versa. Risk factors for developing a form of dementia include environment, age, genetics, and lifestyle factors. Now let's talk about genetics for a minute. It can be sporadic and pop up just somewhere in the family line, or it can be familial, which means that it can be traced through the family line. Now keep in mind that just because it might be genetic doesn't mean that it's going to impact everybody in the family. And lastly, right now, dementia is affecting women more than men, but this is something that might change in the future. But for right now, this is the statistic that we have. Here are the 10 warning signs of Alzheimer's disease. Now, for those of you who are working in our traditional communities, keep these signs in mind because this is where you might be seeing changes happen that you're going to want to bubble up to your nurse and your community leaders so that they can be monitored a little more closely. These changes include memory changes that disrupt daily life. So again, going into the kitchen and not remembering why you're there might not disrupt someone's daily life. But taking medications when they've already been taken or forgetting to take them altogether could be quite a significant problem. Changes in planning or problem solving. Difficulty completing familiar tasks. Imagine having a toothbrush in your hand and knowing that it's a brush, but not quite remembering what type of brush it is, and brushing toothpaste through your hair instead of on your teeth. Confusion with time or place. I'm not sure about anybody else, but in January in Maine, 4 o'clock in the morning and 4 o'clock in the evening look a lot alike. So waking up in the morning or waking up from a nap could be kind of confusing, and maybe in the afternoon somebody's looking to have breakfast. Trouble understanding images or spatial relationships. Somebody might take a big step over a shadow, or might have a hard time with transitions between maybe a wood floor and carpet. New problems with words in speaking or writing. Now here I want to mention that it's important with all of these signs to keep in mind somebody's baseline. And the reason why I mention that is because it's very normal for me to have a hard time finding my words sometimes. But for somebody who is a news anchor and very articulate for their whole life, a difficulty finding a word could be a very significant change for that person. Next is misplacing things and losing the ability to retrace steps. I don't remember where I've been to know where to look. And also that suspicion that maybe those things have been stolen, even though they've just been tucked away. Decreased or poor judgment, withdrawal from work or social activities. And this can happen for a number of reasons. Maybe somebody's aware that they can't keep up with the conversation, so they're not going to a meal as often. Or maybe they forget that it's time to go to that group, or think it's a different day, so they don't go. Or there might be a loss of initiation, or they don't know how to get there, so then they don't end up going to those activities. And finally, changes in mood and personality. Now this can go both ways. It could be somebody that was very rigid and strict for their whole life, and now with these brain changes, they've become very pleasant and very easygoing. Or it could be somebody who was maybe prim and proper for their whole life, and all of a sudden they're saying and doing things that they never would have dreamed of doing before. As I mentioned before, it's important to bring the community leaders and your nurse's attention to any changes that you might be noticing. If there is a concern about memory loss, we want our residents to see a doctor. And what's going to happen with this doctor visit is that medical history and medications will be reviewed, as well as blood pressure, diet and nutrition, and even alcohol or substance use if that's a factor, and as well as mental health. There are tests that the doctor will use to determine the degree of memory impairment. Some of those tests include cognitive assessments, the SLUMS, the mini mental state assessment, or the MOCA, just to name a couple. There's also brain imaging that can be done, and neurological exams such as reflexes, coordination, muscle tone and strength, eye movement, and speech. Finally, we're going to talk about prevention and ways that we can love our brain. Now, keep in mind there's no surefire way to prevent the development of a form of dementia. However, the following list is a list of examples that can help us keep our brains as healthy as possible. Number 1, break a sweat. Engage in regular cardiovascular exercise. Several studies have found an association between physical activity and the reduced risk of cognitive decline. Number 2, hit the books. Learn something new. You could take a class or listen to a podcast, maybe read a book or study something independently. Number 3, butt out. Evidence shows that smoking increases the risk of cognitive decline, so quitting smoking can have the reverse effect. Number 4, follow your heart. Evidence shows that risk factors for cardiovascular disease and stroke can also contribute to the change in cognition. So take care of your heart and your brain might just follow. Number 5, heads up. Brain injury can raise the risk of cognitive decline and dementia, so wear those helmets and seat belts. Number 6, fuel up right. Eating a healthy and balanced diet that is lower in fat and higher in vegetables and fruit can help reduce the risk of cognitive decline. Number 7, catch those Z's. Not getting enough sleep due to conditions like insomnia and sleep apnea may result in problems with memory and thinking down the road. Number 8, take care of your mental health. Some studies link a history of depression with increased risk of cognitive decline. So do those things that are going to help support your mental health. Buddy up. Staying socially engaged may support brain health. Find a friend to do something new or to do something that you've always loved doing. And number 10, stump yourself. Challenge yourself. Do a puzzle. Play a game. Learning something new also helps challenge the brain. Any of these 10 things are things that we can do to help support our brain health. Thank you for joining in on this in-service today, and I encourage you now to take some time to talk amongst yourself to discuss any questions or comments that you might have. Have a great day.